The things
Teamwork.
students have to do. So this is what the heart looks like uncut. Okay? All of this is ventricle. The atria are these little flappy bits on the top here. That's how small they are. So the muscle wall is very thin on the atria. So the base of the heart, where the blood vessels enter and exit, and the ventricles down here. The fat on the heart is normal. There's supposed to be quite a bit of fat protecting it. Here's your coronary vessels. Okay, you can see blood vessels. And so this is why you can't tell whether they're arteries or veins. So name these vessels, and I'll put pins in a few of them. Coronary vessels is your answer. The right side from the left side, the apex, always contains the left ventricle. So the right side and the left side. Right, and if you feel it, you can feel that the right, can you see how I'm being able to push this chamber wall? Whereas this is the left side, not so much. So the right side is a lot thinner. So that would make this the right atrium and this the left atrium. So mostly though, I'll do the opened heart. So this one was opened. So you can see the inside. The chamber size, the volume of blood that will be held in the right and left ventricle is identical. It has to be, otherwise you're going to have issues with heart backing up. The difference is the thickness of the muscle wall. This is the right ventricle because the muscle wall is much thinner than the left ventricle. The cardiac septum is the same size because it's just in the middle. So name this structure, cardiac septum. What tissue is it composed of? Cardiac muscle. Okay, name this chamber is the left ventricle. Name this chamber is the right ventricle. That's what you want to look for. Don't try and look for right versus left. Just look for wall size. Name this chamber, or this structure here, that has to be the right atrium because it's on the same side as the right ventricle. So if you look in, you can see the valve. So name this structure, and you can come up and look at this your own selves so you can see it properly. But that has to be the tricuspid valve on the right side of the heart. Right, okay? Tricuspid valve on the right side of the heart. Another question, name this chamber. Okay, so it's right ventricle. Where will the blood go to next? Through and include all valves, etc., and vessels. Which one?
The right.
Pulmonic?
Pulmonic.
Semilunar valve or just pulmonic valve. To what vessel? Pulmonary artery. Okay, because it's going away from the heart. Good. Where does the blood come from? Through, you include all valves, etc. Through the tricuspid valve from the right atrium. So that's the way I'll ask questions like that. This is the right atrium. Where does the blood come from? Include all valves, vessels. Is there any valves entering? No. So you don't have to, but I say that because then I can be consistent. I'm not giving any hints. So it's come from what vessel? Vena cava. Okay, into the right atrium. Okay, so this is why you need to know the blood flow through the heart, even though I'm not going to ask you to draw it out. So if this is the left ventricle, name the first tissue the pin passes through. If the pin is right here, endocardium. Okay, name the first tissue the pin passes through, epicardium. Okay. Here's your chordae tendineae. Very obvious. What is the function of these structures? Prevent valve prolapse. Okay. Name this structure. And if you're not sure what I'm pointing at, you can always ask, but it should be fairly obvious. This flappy thing here is the bicuspid or mitral valve. I'll accept either answer. And of course, then this would be the left atrium because it's on the left side of the heart. So the whole heart thing is not complicated. It's not hard. You just need to know that your major identifier is the thickness of the muscle wall and the fact that the left ventricle always is the apex of the heart. So on this side, because it's just open, I could use this side too. Name this chamber. It's the right ventricle. Give a reason for your answer, because it's got a thinner myocardium. Do not say because it's smaller, because that is so wrong. Okay, it's the same size. It's got a thinner myocardium. Okay, here's your left ventricle, and the valve is on the other side in this case. So if splashing, if this is the left ventricle, here's the exit going out the blood vessel. What blood vessel is this then? What does it have to be? The aorta. And the semilunar valve is just this little flappy piece here. Okay, so they're there and there. They're not real obvious. Okay, so I could pin, have done. Okay, the AV valves are easier to pin, but this is a really nice semilunar valve, and you're not sure. I'll say, well, it's not this. How can you tell that? What's the main structural difference between a AV valve and a semilunar valve? Chordae tendineae. The AV valves have chordae tendineae attached to them. The semilunar valves do not. So it's this, not this, okay, with the cords attached. And that's pretty much it for the heart. That's, you need to know your chambers, and the size is identified by the thickness of the wall. And again, like I said, the left ventricle always is in the apex of the heart. It's because it's got the thicker myocardium. The size of the chamber is identical, has to be. This one just goes deeper back here. So once you know right from left, you're good to go. Okay, your left atrium is on top of the left ventricle. Your right atrium is on top of the right ventricle. Your tricuspid valve is on the right side. Your mitral or bicuspid is on the left side. Semilunars, you got good to go. Which vessel is associated with your chambers? Piece of cake, sort of. Okay, if you study. Well, I can always do it again if you want. Okay, so you can have access to this for the rest of the day, and then obviously not next Friday, but the Friday after, you can see all this again. Okay?
So you'll have it like that on
Yes.
the exam?
Yes.
Okay.
Yeah.
And the
it'll be
full
open.
one too.
Yes, the whole one is quite possible as well. More for the coronary vessels than anything, but if I could put a pin down here, and you'd be able to identify left ventricle. I don't like to do that. I want you to know it opened. Okay? But the coronary vessels, epicardium I can do on this guy externally. And which blood vessels is associated with which chamber. Okay? Good. Okay?